Good evening everyone. Myself Dr. Swapnil Yadav. I am consultant physician in Suvidha Hospital Usmanabad since last 5 years. Today I am talking with you on the occasion of 14th November World Diabetes Day. This year's theme for World Diabetes Day is access to diabetes care, which emphasizes on the patient care, early diagnosis and treatment, and the awareness of population regarding diabetes disease and its complications, and what are the treatment facilities available or treatment modalities available for the diabetes. So first of all, let me tell you about the diabetes disease itself. Diabetes is nothing but a chronic disease with a continuous state of hyperglycemia. It has two types, type 1 and type 2. Type 1 is mostly insulin dependent diabetes, where pancreas cannot secrete or cannot synthesize insulin, or they synthesize in a very less manner or very less amount, which is also called a juvenile, because these patients are usually very young age patients, and which we are more concerned about type 2 diabetes, which is basically a lifestyle disease, lifestyle diabetes, because it is acquired over a period of time. I would like to emphasize more on why we should treat diabetes basically. So we should treat diabetes not only to treat the diabetes, but to prevent its complications. Prevention of diabetic complications is of paramount importance when we treat any diabetic patient, and every clinician must consider or take into account what might be the complications happening in this patient in, let's say, next 5 years, next 10 years, and accordingly we should prioritize, we should channelize our treatment. So basically, what are the main complications of this diabetes? First is the cardiovascular diseases, because it affects blood vessels. It causes atherosclerosis, it fastens the speed of atherosclerosis. Hence, the cardiovascular diseases in the form of ischemic heart diseases, ischemic strokes, paralysis. Then we have this diabetic nephropathy, very challenging disease, because we are running a huge dialysis center in our hospital, and looking at the amount of these morbidities and mortalities among these dialysis patients, almost 70 to 80% of patients on dialysis are having diabetes. So it's a huge burden both on the families of these diabetes CKD patients and also on the nation. So it is basically what we are lacking right now in the treatment of diabetes, is we are not considering the possibility of complications in these patients. Third one is the diabetic retinopathy. It causes blindness. These are irreversible states. Once diabetic retinopathy sets in, it's incurable, it's irreversible. And then there are other things like peripheral vascular diseases, non-healing ulcers. It reduces your immunity. When a patient of diabetes gets admission into the ICU, it brings alarms into the clinicians' ears. It's a huge hurdle in the treatment of these patients. Diabetic patients present with a variety of illnesses. It's always getting difficult to treat diabetic patients as compared to non-diabetics ones. So what should we do? The treatment or prevention of diabetes starts at very early age. We must consider our genes first. We must consider the diabetes in our parents, their parents, our siblings, brothers and sisters, and accordingly we should take care of that thing. If your both parents are positive for type 2 diabetes, you should take extra precaution. Since like 25-30 years of your life, you should avoid all the risk factors leading to type 2 DM, type 2 diabetes mellitus. So basically there are 5 things on which the treatment of diabetes is based upon. First is having healthy diet. To have a good healthy diet is of paramount importance for the treatment of diabetes, because eating less carbohydrates, less oil, less junk food, or the foods having higher glycemic index, we should avoid that. We should have more fiber diets, more fruits having vitamin C's and D's, all vitamins. We should exercise more. At least a 30 minutes walk per day, at least 5 days a week should be the formula for your rest of your lives. You should have your weights in control. Weight reduction. Many of my patients have reduced their weights and they are now off the anti-diabetic treatment. So this is weight reduction is of great importance. Fourth is treatment. Tablets, insulins, then variety of other things comes on fourth way. On a priority list, medicines are at fourth number, and fifth is self glucose monitoring. Because once you are on treatment, you are having diabetes since 5 years, 10 years, you should monitor your sugars regularly at regular intervals, say 1 month, 2 months, 3 months, depending on the severity of illness, depending on your sugar levels, as prescribed by the diabetologist, expert diabetologist. So this is basically 5 pillars of treatment. And most important, once you getting diagnosed as a diabetes, do not ignore it, do not neglect it, do not be overconfident about it, do not be complacent about it, because diabetes has no role of complacency in diabetes, because you are unaware about this or you are neglecting it for 2-3 years, and suddenly you land up with some complications, and these all complications which are listed above are dreaded one, because we are seeing it day in day out in our OPDs. People are suffering, their families are suffering, communities, societies are suffering. It is no life. So before it's too late, get started. Hit early, hit fast is the message on this day I would like to give to all.